Had a good start last week. Thank you for being so flexible, coming from the Family Center to the auditorium. I think this is, feels a little better, doesn't it? A little more air. Without further ado, I'm just going to quickly introduce this man. Became a friend about a year ago with John. Worked on my back, so I highly recommend him. So I'm upright and I can still walk. So you come with good recommendation, John. John really knows this area very well. In fact, he knows this entire Memorial area, Harris County area, grew up here. He comes from a line of surgeons. His father was a urological surgeon. John received his Bachelor of Science at Lamar University, a doctorate from Texas College of Chiropractic Medicine. He has 2 postgraduate degrees from Southwest College of Naturopathic Medicine and Diplomatic in Chiropractic Orthopedics. He's an adjunct professor. He developed some good instruments for NASA. In fact, he worked with a team of NASA physiologists to help solve the problem of muscle atrophy found to occur in astronauts during the Space Shuttle program. The man is rich in credentials, and I'm not going to take up much of his time because I'm really looking forward to what John has to share with us tonight on watching your back.
Am I on? You can hear me. Well, first of all, I'm going to step out of light. Thank you for being here. I really appreciate you taking your time to come out and hear about what I consider to be an interesting subject. It's what I do. I believe that we're all given share, and it's really wonderful when you happen to be able to do that as a vocation, something that you can share with other people, and I feel blessed in the fact that it's one of my strongest passions. I did grow up in the Memorial area, in fact, where the skydiving place used to be an office of mine for 20 years. I looked around the audience to see if anybody is former patients. Do I owe anybody any money? Very good. Very good. Excellent. My special thanks to Dr. Martin, friend and colleague, for inviting me, and it's an honor to be here, truly. It's interesting, my sister was in the first graduating class from Memorial High School, so I've driven past here thousands upon thousands of time, and it's like home, and yet when I walked into the church here, it felt like home because everybody is so kind and friendly. I am a chiropractic orthopedist. I'm also a naturopathic physician. I'm trained in homeopathy and nutrition. However, my specialty has been in the spine. I'd like to have a show of hands if I could. Has anybody in here ever had or known anyone that's had back pain? Raise your hand. If you... Okay. Very good. I'm going to ask another question because I like to know the audience. How many people here are below the age of 65? Below, not over, below the age of 65. Below the... Excellent, very good. There's a few people here that are younger than I am. I'm just kidding. For about the past 40 years, I've dealt with a condition that we term mechanical spinal pathology. And it's extremely stressful because we're mechanical beings. Our bodies are perfectly engineered to stand upright on 2 legs. And if you'll notice your dog, cat, horse, cow, your table, they have 4 legs for stability. So the synergistic involvement of the muscles, tendons, and ligaments that keep us upright really, truly a miracle. Because the first thing that happens when a baby is born and starts to crawl, the next thing they do is they stand up next to the couch, and the next thing they do is what? Step away from the couch and fall down. So what the body does in this miraculous development of computer files in the brain is it develops what we call proprioceptive pathways all through the neurological system so that the brain can recall how to walk. And we learn to crawl and then walk, and then we learn to run. And so that's the beginning of our experience, but one of the things that you might want to think about is the fact that babies don't have back pain. Babies don't have back pain. Now, I'm talking about mechanical back pain. Understand I'm differentiating between mechanical and medical. Medical meaning that you have a tumor or an infectious metabolic disease. Mechanical means there's a disruption of the normal integrity of the spine, the muscles, the tendons, the ligaments. You have 24 vertebrae that are miraculously stacked on top of the other, that are well balanced, and that have the ability to be separated if you remove those support structures. So it's very important that the balance of those muscles, tendons, and ligaments maintain. See if I'm going to get this right. There we go. Maintain these curves. There's actually 3 curves, the lordotic, cervical, the thoracic, and the lumbar, but there's also a sacral base curve. And this balance has got to be maintained so that the distribution of weight is shared amongst all the vertebrae. And that distribution and the muscle strength is what determines our rate of degeneration. Has anybody in here ever been told by any doctor that they are developing arthritis or spinal degeneration? Raise your hand. Has anybody ever heard that? Okay, there's a few. And spinal degeneration is something that if we all live long enough, it will happen. It's the same thing that happens with tooth decay, with cavities. But as children, as soon as we get our first tooth, what do we get? Our first toothbrush, right? We get a toothbrush. And quite frankly, we don't have to use it, but our parents tell us to use it until the first time that we do what? We go to a dentist because we didn't brush enough and we got a tooth decay. So when the dentist pulls out the drill, and I hope there's not any dentist in here that I'm offending, but when you pull the drill out, this the sound does strike fear into the hearts of children. And the next thing you do is say, here's your toothbrush, and the kid starts brushing. He doesn't want to go back. They learn that through trial and error. But the difference, of course, with the human spine is that it takes years of abnormal dynamics of spinal mechanics before we develop back pain. In fact, the insidious onset of back pain, that stress change in our spine that reaches what we call the pain threshold, usually occurs around age 33. And that means if you've never played football, you've never been in a car wreck, you've never had a chair pulled out from underneath you as a joke by a friend. I always thought that was not funny. So my goal over this session and the next session, number one is today I'd like to build a case of understanding, of recognizing that mechanical spinal pathology is a process that we have some degree of control over. There are inherited, congenital, and acquired issues. Inherited we get from our parents, congenital we get from birth. Has anybody ever been told that they had one leg shorter than the other? Okay? I always like to say one leg shorter than the other because we have one back there. You can put a lift in and you can lift it up. If you have one leg longer than the other, you have to cut it off. So I prefer to... So mechanical refers to anything that alters the normal spinal dynamics. In fact, 98% of the people that have back pain have mechanical spinal pathology. Mechanical spinal pathology. I had a patient, I'm just going to share this with you. It's not a violation of HIPAA because you don't know who they are. But I had a patient that came in that had back pain since 1998. In 1998, this 41-year-old person was in the military. And in the military, one of the things that they did was jumped out of airplanes. Do you have any idea where I'm going with this story? He jumped out of an airplane and the chute did not deploy. And about halfway down, I guess the good Lord said, let's give him a little bit of chute, and all of a sudden half a parachute came out. And he had to decide in a split second whether he was going to use his emergency chute or not, which he decided against, which I think saved his life. So he went into the ground with only half of the chute and bounced a few times and was later given permanent disability. And since that time, since 1998, he's been suffering with back pain. He walked with a cane. He's really in good health otherwise, but I asked him, what kind of medications are you taking? And his response was, I don't take any medication. My problem was not caused by a drug deficiency. And it makes you think when you realize that so often what we do is we take things to just cover it up as opposed to learning to keep going and keep moving forward. And he heard about what we did, and he came in strictly because he thought, well, I'll give that a shot. I'm going to move this back over here because that is a bright light. So let's think about the direction that we're going as a physical human being and the idea of pain relative to our humanistic form. Everybody experiences pain in their life, but nobody's ever seen it, touched it, smelled it, tasted it. We know it's there because we all experience it, but there's no way you can put a cuff on and measure a 120/80 pain level. We use a pain chart on a 1 to 10, but that's relative to you. So what I want you to think about is if you have pain of any kind, there is a nerve being irritated. There is stress on a nerve. There's stress on a nerve. You have a brain, you have a spinal cord that goes through your spinal canal inside of your spinal column. And it is so well protected that hopefully it's never damaged, but sometimes it's moved and it's shaken and it's jarred to the point where it exceeds the normal support capacity of the muscles, tendons, and ligaments. There's two things that I want you to think about, and hold this thought even until next week when we'll get into the actual treatment options that you have in terms of things that you can do for yourself. Number one, as we age, we get weaker. We get weaker. It's not that you're born and you keep getting stronger all your life. Usually by the time you're 18 to 22, you've kind of reached that pinnacle. You're at that optimum level of human functioning as a growth pattern. And then we start to decline. It's not like an airplane that's crashing, but we have a slow descent dependent upon our lifestyle. Do we drink, smoke? Do we exercise? Do we have positive mental attitude towards things? Is our nutrition and our diet, is it where it should be? And we'll discuss some of those things as well. But all of these will have an impact on our muscle strength, because you cannot separate the mechanical, chemical, and psychological impact or stress on our nervous systems. And that is very, very, very important, because that is our human physiology. The second thing, as we age, because we assume the upright position, the time under load of compression of the spine is stressful. A person who is 10 has slept, what? 1/3 of his life? 2/3 are either standing or sitting. A person who is 30 has stood or sat 20 years. And a person who's 60 has been upright or sitting, posturally balanced somewhere over their pelvis, hopefully, for what, 40 years? 40 years. So the time under load increases with age, which means the greater amount of compression. If you think back when you graduated from high school at age 18, you think of your approximate weight at that time. Where are you now relative to where you are then? And as you've aged, has the load increased as well as the time? So those are things that I want you to keep in the back of your mind. I want to build a case. Go to the right here, correct? Very good. Low back pain. We talk about sciatica. People here, they say they have sciatica. The sciatica is defined as a irritation of the sciatic nerve. It's pretty much that simple. But we hear the term, and oftentimes there's terms that we don't understand. So I'm going to kind of demystify and clarify some of the terminology and some of the concepts we have. One of them is that surgery is the last resort. Has everybody heard that when they've talked to friends and family or themselves about back pain? Surgery is absolutely the last resort. Unfortunately, a resort is a vacation and surgery is not. So when we think about it, we have to think about surgery as being an option. And some of my colleagues and partners in clinics that I've had where we've treated mechanical spinal pathology have been really good surgeons, some very innovative, some are very talented in their field. But if you have the idea that I'll just put it off and at some point I'll have surgery, the statistics say that's not a very good idea. Low back problems account for more than 12 million visits to doctors' offices a year. 12 million visits. Now, these are the people that go. This does not mean that's all the people that have back problems, because there's an awful lot of people that have back problems that quit going because they found that they didn't have a drug deficiency. According to the American Academy of Orthopedic Surgeons, 8 out of 10 people will experience low back pain at some time in their life. 8 out of 10. 80% of the people that are walking in the upright position at some point in their life are going to experience back pain. Unfortunately, a lot of those people experience back pain continuously. Besides the common cold, back pain results in more lost days of work than any other physical affliction in persons under the age of 45. Under the age of 45. So you don't have to say, well, back pain is a condition of the ages. People start getting back pain when they're in grade school. They just don't think about prevention, which I call spinal hygiene. Spinal hygiene. We think about dental hygiene all the time because you smile, people see you, and you don't want to have a bad smile. So you go to the dentist to make sure that your smile is nice. But we don't hold a mirror looking at our back and go, you know, my back muscles don't look really strong today. Very few people, if any, do that. And yet, as our strength declines, so does the stability. Does that make sense? Yes? As the strength declines, so does the stability, because the spine is only as strong as the muscles that support it. That's an indisputable fact. And yet we don't think about it because nobody teaches that to us, because why? There's no money in it. I hate to say that, but the truth of the matter is, if you go to the doctor and he goes, hey, you need to go exercise and strengthen your back, you go, that's it? I don't get a drug? I want some kind of what I call it the jack-in-the-box cure, right? You drive through, you get a cure, and then you drive off. We just don't have time. People that don't have time for good diet and good exercise and positive mental attitude will find time to be ill at some point in their life. And all the statistics are out there, whether it's cancer, back pain, or other stressful illnesses. The reality is that we can do as much or more for ourselves than the doctors can, because our healer lies within. Our body is what changes and what cures. You know, the finest surgeon in the world that takes a slice in the leg and sews it up. You walk in, you accidentally cut your leg, and I'm using the leg as an example. That doctor is going to push the tissue back together and put the sutures in. I've seen my dad do it 1,000 times. He didn't heal the person. The body healed itself. The point is, you have to create an environment for healing. And if it stayed gaping open, that environment is such that infection would set in and it would not possibly heal. So the body's going to heal itself.